Mutongoria wa bururi Dr. William Ruto muthenya wa umuthi ni ahingurire Labu ya Microbiology mwena wa Syokimau kaunti-ini ya Machakos kuria anyitirwo ugeni ni minista wa ugima wa mwiri nakhumicha uronyitete itemi rinene hari guthondekwo kwa Labu iyo iria muoroto wayo ni kugacerithia motungata ma urigitani.
This institution is a critical cog in delivery of healthcare in this country.
Universal healthcare is not one thing. It is not one facility. It is a symphony of many elements coming together efficiently and effectively.
Ruto ugite ati Labu iyo ni guteithiriria hanene kari kuhura njeki motungata ma urigitani guku bururi-ini hamwe na nja wa bururi na kuriongereire ati watho riu ni ugathikitwo kuri mathibitari maria matongoragio ni andu kiumbe hamwe na makanitha kuingira mutaratara-ini wa thirikari wa kuheana motungata makinyaniru ma urigitani.
The supply of health products and technologies is a key pillar towards the realization of UHC. Medicine is only important if it reaches people.
Ruto ugite ati thirikari yake na muoroto wa kunina marihi ma insurance sekta-ini ya ugima wa mwiri nigetha akenya mahote kwamukira urigitani mukinyaniru matekuriho na teni kuria akenereire atongoria makanitha ni uria manyitete mbaru mubango wake wa kinyaniria motungata ma urigitani hatari marihi.
The partnership and collaboration will not only benefit the institutions, but it will also benefit our health provision ecosystem in its totality.
Ruto ugite ati insurance irihagwo ni mundu uria wina uhoti nake mukenya uria utari na uhoti aririhagirwo ni thirikari yake akiuga ati riu thirikari yake ni iciritie wanji kwa gikiro kia thi kuona muoroto wake ni gukinyaniria motungata ma urigitani kuri akenya.
We are currently working with KEMSA to make sure that technology becomes part of the equation and becomes an enabler of the delivery of service. And that is the reason why members of parliament passed the digital health bill.
Hadoine ha Muthingi TV ni echitagwo Ng'endo wa Njogu.